Hello and welcome to this GIS report with Health in Perspective. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist NATASHA LETTSOME. We have an interesting program for you today where we'll be talking about developing a national formulary. To share more about what a formulary is, why we need it, and some upcoming training, we have with us the Chief of Drugs and Pharmaceuticals, Mrs. GRACIA Wheatley-Smith. Mrs. Smith, thank you for joining the program.
Thank you for having me, Ms. Lettsom.
Not a problem at all. Now, to get us started, tell us what exactly is a formulary and the difference between a formulary and a national formulary.
Well, a formulary is basically a manual with a listing of medications, side effects, uses, contraindications, etc. The difference with a national formulary now is that a national formulary addresses the national disease patterns of a specific country, the major ones for the major population. So it doesn't address everything, but it ensures that medication is easily accessible and readily available in the country, addressing the majority medical concerns of the majority of the population.
Now, what are the benefits of developing and implementing a medicine formulary here?
Well, there are many benefits for having a national formulary. Number one, and top of my list, is that it gives us unbiased information. Now, when medical reps come around and they're promoting their own products, sometimes the information can be a bit skewed. And if you aren't astute to pick up on the differences, you can be fooled into buying something that a country doesn't need. So that is also an economic benefit, because therefore it keeps you along the line of your economic focus to ensure that you can maintain within your budgetary allocations. So one, it gives us impartial information. Two, it gives us economic benefits to ensure that we don't overspend. Three, it gives us the list of safe, effective, good quality medications, and it rules out ineffective medications. Also, it points us in the prescribing and the dispensing process. And it enhances all of that to take care of our medical needs.
Nice. So can a formulary be specific?
Of course, a formulary can be specific according to your national needs. Now, there are diseases in Africa that are not prevalent in the BVI. So it doesn't make sense for me to have a formulary that addresses those diseases. There are diseases here that are not prevalent there. So it wouldn't make sense for them to have that formulary. So also a formulary can be specific in reference to your practice. So we can have formularies for adults, such as this one, the BNF for adults, and we can have formulary for children, such as the BNF for children. And we can also have our own regional formulary with the OECS, or Organization of Eastern Caribbean States Procurement Pharmaceutical Service, which is this one, which we procure a lot by. So we can have specific formularies according to our pharmaceutical needs.
Now, locally, you mentioned that a national formulary is based on our local needs. What are some of the issues or some of the diseases that you see that we would require that formulary for?
Well, we would require that formulary definitely for hypertensive cases, or diabetics, or asthmatics, or infections. We would be covering those, but those that are specific address the majority needs of the BVI populace.
And how will having that in terms of that specific formulary for the diseases that are most prevalent here beneficial to persons who will be accessing that medicine?
Well, when we look at the amount of medicines that's available worldwide, no individual country, no matter how developed or even underdeveloped, can afford to procure or even stock or store the amount of medications, because there's so many medications available for just one treatment. So therefore, having your national formulary would bring you to, what should I say, streamline your treatment in making sure that there are certain medicines available in your country. Let's say if there's hypertensive, let's say you have 300 medicines available, because pharmaceutical companies are all about their money, yes, producing, yes, but they also want money. So they continue to produce, promote, and say this one is better than. So you could end up with 300. But when you look at it, a country may only be able to afford to stock 10 or 50. And therefore, with a formula, with the process you go through in ensuring that you get the best because there's a scientific process in which you go through to evaluate the medicines that should be placed on your formulary. We can still get the best of those 300, but at a more economic price so that the country can purchase that to ensure that it's available to all its populace.
And what are some of the things you're looking at when determining what should be placed on the formulary?
We are definitely looking at therapeutic efficacy. We have to ensure that it is efficacious, it will do what it is supposed to do. If it's diabetes, it will bring down your blood glucose. If it's hypertensive, it will bring down your blood pressure. If it's asthmatic, it will prevent your bronchioles from constricting. If it's infection, it will take care of that infection within a manageable time. So definitely therapeutic efficaciousness of the medicine is one of that. We also look at side effects. We want it to be therapeutic, yes, but we also want to be able to manage the side effects and to ensure that the side effects a medicine brings with it would not cause a patient to stop taking that medication. So we look at therapeutic efficacy, we look at side effects, we look at contraindication, we look at cost. Drug A, is it more expensive or least expensive than drug B, and is it more therapeutic? So we would be comparing apples with apples and bringing the slices down to see which would benefit us in the BVI.
Nice. Now tell us about your upcoming workshop and how it all fits into what you're talking about.
Well, with the implementation of the NHI, National Health Insurance, like I said, no country can afford to procure all the medicines in the world. So we therefore need to do that and practice cost constrainment because of economic times. So therefore, if we do the workshop on developing the Virgin Islands National Formulary, we would be looking at things such as how to evaluate medicines to ensure that they can be placed on the formulary, to ensure that the accessibility to medicines is available throughout the British Virgin Islands. We would also be looking to how to evaluate, critically appraise medical information. Because when a medical rep brings you something, sometimes their own pharmaceutical company does the research and does the promotion and does everything, and the brochures look nice and etc. But we want to know how to critically appraise that information and any other information that we would get on reputable sites such as the Cochrane, the NCI Medical Library, to be able to take that to read and analyze to ensure that this is the medicine that we need to have placed on our formulary to benefit our population. So we'll be looking at cost. How does it cost? How, looking at administration of the medicine, the nurse's time, factoring in the nurse's time, the doctor's time, how it is to be administered, the therapeutic efficacy, the availability worldwide. We'll be looking at the regulatory restrictions because there are some medicines that are regulated according to international standards, such as on narcotics and so forth, and to ensure that we stay within the limits so that medicines will be available at all times. So we'll be looking at administrative versus medicine and also regulatory benefits of medicines on our formulary.
So who are you partnering with?
I'm partnering with the Organization of Eastern Caribbean States Pharmaceutical Procurement Service, OECS PPS. This is a partnership that has started since 1989 under the government of Honorable Lavity Stout, and it has maintained here. And recently, last year, we had a procurement and supply chain management workshop to strengthen our procurement skills within the private and the public sectors. So Mr. Burnett, Francis Burnett, who is well-versed in formulary development, he was actually the Pan American Health Organization consultant for developing the formulary for Brazil. He will be here with me conducting the workshop on Monday the 4th and Tuesday the 5th of July, 8:30 to 3:30 at the Peebles Hospital Training Room. And hopefully with that, we'll be able to do a lot of capacity building in the areas that I spoke about, critical appraisal and so forth, so that we can now, after the workshop, go into sessions that can develop our national formulary.
Nice. Go a bit more, tell us a bit more about Mr. Burnett, a little bit of his background and why he's beneficial to the workshops.
Mr. Burnett, as I said, he is the head of the procurement service. He's very versed. He is a bachelor degreed pharmacist, and he has been here, and he has spearheaded the compilation of the OECS formulary, which is now in its 8th edition. This is the 7th edition. So we are now currently reviewing the 8th edition and getting it ready for printing. And he has been very instrumental in that. pharmacology is his strong area. So what drugs do to the body and what body do to the drugs. So he's able to guide a lot of that discussion and to present that information unbiased so that we can ensure that we have capacity building in the British Virgin Islands.
Mm-hmm. And in terms of the workshop, why is it necessary? And who are you targeting?
It is necessary because we need to develop our own national formulary. We can no longer just, because a medical rep come and say, here is a medicine, it is better than ABC, we can no longer do that. Economic constraints is happening all over the country, all over the world. And we want to ensure that medicines are easily accessible and readily available in the British Virgin Islands. And the only how we can do that is practice cost constrainment by implementing a formulary. Mm-hmm. We are targeting doctors, nurses, pharmacists, pharmacy students, pharmacy technicians. We have a number of pharmacy technicians in the British Virgin Islands, doctors in training, anyone with a medical background. We have sent out letters of invitation to the hospital, to the private institutions, and we are hoping that they would release their employees. We know it is 2 days, but what we want to do is capacity building. So we are hoping that they would release the employees to attend the session. And it would not only benefit the country that we can develop our own formulary, but it would also benefit the practices from where these individuals come, because then they can take that knowledge and review how they buy pharmaceuticals.
Mm-hmm. In terms of continuing on, what are some of the outcomes and objectives you have set for the workshop? What do you hope to achieve individually as a company and as a territory after having this workshop?
After having this workshop, I envision that we will have capacity building in so many areas of formulary development, because once you develop a formulary, it doesn't stay that way forever. Diseases will come, diseases will go, we will get control of diseases and so forth. There are new things on the horizon, new superbugs and everything. So a formulary has to be going constantly under revision, especially with pharmaceutical companies bringing out new products. So we need to have that capacity building here so that we can have a variety of individuals coming together to evaluate our national formulary, to delete and to add medications as is dictated by our disease patterns. So we're looking at capacity building. We want to ensure people can critically analyze medical information, that they can do their journals and so forth, and we can get the best medicine selected according to the disease pattern of the British Virgin Islands, and therefore have a healthy population in the control and the maintenance of these conditions.
Mm-hmm. I know that you have a continuing education session on hypertension on the evening of July 4th. Speak a bit about that.
We have a continuing education session. Mr. Burnett has graciously consented to, although we are doing the workshop all day Monday, that we are going to put on these continuing education sessions for doctors, doctors in training, nurses, nurses in training, pharmacists, pharmacy technicians, and pharmacy students. All can attend. It is the latest treatment in hypertension. Now we know we have a lot of hypertensive patients in the BVI, and so we want to ensure and share this information about the latest treatment. So we are asking them to come out. This CE session is open to anyone. They can come, they can register with the Ministry of Health, because we're going to be offering continuing education credits. So they can register with the Ministry of Health by calling 468-2880, 468-4398, or 468-9850, or even dropping an email to grwheatley-smith@gov.vg to ensure their registration and their place at the CE session.
Mm-hmm. Now, as we wrap up, I want you to link this whole formulary, not developing a national formulary, back to, the conversations we had regarding pharmacovigilance. How does it all tie in? And I'll leave you the opportunity to make any final thoughts.
Well, pharmacovigilance is being vigilant about our medication. Mm-hmm. And in evaluating medicines, you're looking so much at the side effects and the contraindication that can give us a heads up as to what we may expect that will happen, because medicines are foreign entities that we are putting in our bodies. So we may have interactions, we may not. It just depends on certain factors. Could be our lifestyle, because there are certain medications, you use them, you should not be spending excessive time in the sun because it makes your skin more sensitive. So it could be our lifestyle that would cause an adverse reaction. It could be the nature of the drugs. Antibiotics, we know, would give us diarrhea because they deal with the bacterial flora in the intestines. So when we do that, we can kind of look and see what can be expected. Also, pharmacovigilance also is with the safe use of medication. So we can do what we call drug utilization reviews because of that. And you see that the doctors are prescribing the medication as they should be prescribing it in the safe dose, not outside of the dose, for the period of time that it should be and for the particular disease pattern that it should be prescribed for. So all of that will tie up in pharmacovigilance because it is looking at the medicines that is in use in the program is what pharmacovigilance is all about.
Your final thoughts?
My final thoughts? Like I said, I know the workshop is 2 days. I am asking the private institutions to release these employees who have been identified in the letters to come so that they can benefit from that information that will be gleaned at the workshop. And then they can also come back and put it into practice. And when we look into establishing a national formulary committee with the capacity building that would be going on from these sessions, that we would have people from the community who we can call upon to serve their country and develop a national formulary.
Thank you very much for coming on the program today, Mrs. Wheatley-Smith, for sharing that information.
Thank you very much.
And we do hope that everything goes well with your workshops.
Thank you so much, Ms. Lettsom.
All right. Thank you for tuning in to this GIS report where we spoke with the Chief of Drugs and Pharmaceuticals, Mrs. GRACIA Wheatley-Smith, about BVI's quest to develop a national formulary and exciting training coming up on July 4th and 5th. Remember, the Ministry of Health and Social Development, in collaboration with the Organization of Eastern Caribbean States Pharmaceutical Procurement Service, will be hosting a continual education session on the latest treatment guidelines on managing hypertension on Monday, June 4th at 7 p.m. at the Peebles Hospital Training Room. Clinicians are asked to telephone the Ministry of Health and Social Development at 468-2280 or 468-4398 or 468-9850 to register for a session. Persons can also email grwheatley-smith@gov.vg with their registration information. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha LETTSOME. Thank you for tuning in.